It was the summer of 2014. I paid a visit to my relatives who live in a tiny little village in Tamil Nadu. During my visit, I happened to go to a government hospital. It was my first time. I had always envisioned government hospitals to be this huge organized space filled to the brim with passionate doctors wanting to treat the underprivileged patients, and the entire space itself having a very cohesive environment. Well, the place I visited turned out to be completely different. The exterior paint almost non-existent, walls filled with cracks, a few flies around, no proper ventilation, and more importantly, no proper sanitation. It was almost as if someone made a makeshift hospital by placing a few hospital beds inside an old building. This experience made me think. I thought about the hospitals I visit when I'm sick and how different it is from the one I just saw. Most of us are privileged to be able to visit a private hospital near us whenever necessary and to be able to afford, more importantly, have access to some of the best facilities a hospital could offer. But what about the people out there who can't go to these hospitals? What do they do when they're sick? Or what do they do when they need to have an expensive procedure done but are not able to afford it? And the scary part is, this category of people aren't few in number. According to the 2019 Multidimensional Poverty Index report by the United Nations, 364 million Indians live in multidimensional poverty. So that is 364 million people who earn approximately only 27,000 rupees per annum. An average 3-day hospitalization in a private hospital in India is 25,000 rupees. The cost of getting sick in India has tripled in the past decade, and for more than half of the Indians, the affordability of hospitals remains crucial. This increase in prices and reduction in accessibility has brought into existence a huge gap in the healthcare system in India. So how did we get here? How did our healthcare system get to the point where one has to fight between costs and good treatment? Well, it wasn't always like this. After India attained independence, a number of primary and secondary healthcare centers were set up. There were very few private practitioners, mainly providing outpatient services. Very few government hospitals had tertiary care facilities. But how could these very few government hospitals cater to the requirements of a nation of over 600 million people? They had highly skilled but overworked doctors, and they bore the significant burden of providing tertiary care to a large number of people. This is where private hospitals set in. These hospitals were built lavishly, with facilities and equipment that were only heard of in Western countries. They included comfort and, more importantly, had excellent emergency care. So a shift began in the late 90s when the majority started visiting these hospitals instead of public hospitals, and gradually government spending on public hospitals also declined. The result of this is that a large number of citizens are constantly caught in a bind over seeking care in government hospitals with inadequate infrastructure versus private hospitals that are very expensive. Now, we can't entirely blame private hospitals because we must remember that private hospitals are a business venture, not a charitable one. Any hospital providing such care does so after spending lots of money on land, electricity, operating costs, equipment, etc. They need to recover these costs as well as get profit in order to stay sustainable. Now, one way we can help is by targeting the public healthcare system. India's per capita expenditure on healthcare remains the lowest in the world. 10.6% of the interim budget is allocated for defense, while only 2.2% is allocated for public healthcare. Surely we can make healthcare a priority, right? To conclude, I would like to say that the only way our healthcare system will be fixed is if we think of effective solutions and implement them today, now. Only then can we ensure a good and healthy India tomorrow. Thank you.